Have you ever treated a vaginal infection only for it to come back again and again? Be it vaginal yeast infection, bacterial vaginosis, or trichomonas vaginalis, and many others. You are not alone. Many women experience recurring vaginal infections, and the reasons may surprise you. Hi, I'm Dr. Lucy, and this is Know Your Health with Dr. Lucy, a space where we share everything related to your health and understand your body better. So if you're interested in such kind of content, do well to hit the subscribe button and turn on the notification bell so that you do not miss any new upload. Alright, in today's video, we're going to break down why these infections keep coming back, what might be triggering them, and most importantly, what you can do to finally get rid of these infections. One of the biggest reasons these vaginal infections keep coming back is incomplete treatment. This simply means that the infection was not fully cured. For example, sometimes when you begin treatment, the itching or the discharge improves after a few days. Now, the biggest mistake women make is that they stop using these medications thinking that they are cured. But what really happens is that when you stop this medication halfway, the germs causing the infection are still left behind. And these leftover germs, be it bacteria or yeast, grow and multiply again. And within a short time, the infection comes back, sometimes even stronger than the previous one. Therefore, it is very important to finish the full dose of medicine exactly as prescribed by your doctor, even if you feel better. It gives the medicine time to completely wipe out the infection from your body. Another common reason why vaginal infections keep coming back is wrong diagnosis. You see, not every vaginal infection is the same. For example, a yeast infection, bacterial vaginosis, or some sexually transmitted infections can all cause discharge, itching, or a bad smell. Now, if you assume there is always a yeast infection and you keep buying antifungal creams, yet the real problem is bacterial vaginosis, then this infection will not go away. Instead, this infection will keep coming back because the real cause is not yet treated. That's why it is important not to self-diagnose all the time. If the infection keeps returning, it's better to see a doctor and get proper lab tests. That way you will know exactly what type of infection it is and you'll get the right treatment. Another reason these vaginal infections keep coming back is the overuse of antibiotics. Now, the problem with antibiotics is that antibiotics are medicines that kill bacteria, but they do not only kill the bad bacteria. They can also wipe out the good bacteria that protects your vagina when used poorly. These good bacteria, especially lactobacillus, they help keep the vaginal environment balanced. When antibiotics kill them off, the balance is destroyed. This creates a perfect chance for yeast or other harmful bacteria to grow out of control, leading to repeated infections. So if you've been on antibiotics often, maybe for things like cough, UTIs, or skin infections, and you notice your vaginal infections keep coming back, then this could be one of the main reasons. Another reason is your lifestyle or hygiene. Sometimes it's the small daily habits that keep infections coming back. For example, wearing tight underwear or clothes that do not allow your skin to breathe. This can trap heat and moisture, which makes the vagina a perfect environment for yeast or bacteria to grow and multiply. Using scented soaps, sprays, or vaginal washes is another big problem. These products may seem fresh, but they actually disturb the natural pH balance of the vagina, making it easier for infections to keep coming back. Even simple things like not changing out of your sweaty clothes after workout or staying in a wet swimsuit for too long can also trigger infections. The key point here is the vagina has its own natural way of cleaning itself. So sticking to cotton underwear, avoiding harsh products, and keeping the area clean and dry can be a way of preventing repeated infections. Another reason why vaginal infections keep coming back has to do with sexual activity. Sometimes infections are passed back and forth between partners. For example, if you get treated and your partner doesn't, you may find that the infection returns shortly after intimacy. Also, having unprotected sexual intercourse with either new or multiple partners can change the natural balance of the vagina. Semen itself can affect the natural pH of the vagina, making it easier for harmful bacteria or yeast to grow and multiply. This doesn't mean that sex is bad, don't get me wrong. It simply means that when infections become recurrent, it's important to treat both partners to prevent the recurrence of this infection. And also, using infections like condoms can also prevent the risk of infections coming back. Another reason these vaginal infections keep coming back is uncontrolled health conditions. For example, women with diabetes are at a much higher risk of getting recurrent infections. This is because high blood sugar feeds the yeast in the vagina and makes them easier for them to grow and multiply. If the diabetes are not well controlled, the infections will continue coming back no matter how much treatment you use. Also, if your immune system is weak, maybe due to stress, lack of sleep, or other medical condition, your body might struggle to fight off infections on its own. That's why if you keep getting infections, it is important to check your overall health too. So managing conditions like diabetes, boosting your immunity with healthy lifestyle, and reducing stress can make a big difference. And finally, hormonal changes. This can also be a reason why vaginal infections keep coming back. Your hormones play a big role in controlling the balance inside the vagina. For example, during pregnancy, the rise in hormones can increase discharge and change the vaginal environment, making yeast infections more likely. Some birth control pills can also shift the hormone levels in a way that favors infection. And also, when women reach menopause, lower estrogen levels can cause dryness and thinning of vaginal tissue, which also increases the risk of vaginal infection. So if you notice your infections keep coming back around certain times, like pregnancy, while on certain contraceptives, or during menopause, hormones could be the hidden reason. With all that being said, do not ignore recurrent vaginal infection. If they keep coming back, it is important to get checked up by a healthcare professional so you can get the real cause and get the right treatment. That way you can finally break the cycle and get lasting relief from vaginal infection. Thank you all for watching, and if you found this video helpful, don't forget to give a thumbs up, share it with a friend, girlfriend, or wife who may find it useful, and subscribe for more health tips like this every week. Let's meet again in the next video. Bye!